all over Gaza, the impact of incursions and evacuation orders are being felt. 6 hospitals and 9 primary health centers have been impacted. Over 70 shelters have now lost access to their medical points. Daily consultations have fallen by close to 40% and immunization by 50%. Approximately 700 seriously ill patients who would have otherwise been evacuated for medical care elsewhere are stuck in a war zone. At a time when the people of Gaza are facing starvation, we urge Israel to lift the blockade and to let aid through. WHO has prepositioned some supplies in warehouses and hospitals, but without more aid flowing into Gaza, we cannot sustain our life-saving support to hospitals and the population. WHO and partners have managed to deliver small amounts of fuel to hospitals in recent days, but this falls far short of the 50 to 60,000 liters of fuel that are needed each day for health operations. Without fuel, ambulances can't reach patients, and life-saving services like dialysis can't continue. WHO, what is needed now more than ever is a ceasefire and to get aid flowing into Gaza. Fadila, back to you.
Thank you, Dr. Tedros. I would like now to open the floor to questions from journalists. If you want to ask a question, please raise your hand using the raise your hand icon. Let's start with Agnès Pedrero from Agence France Presse. Agnès, you have the floor.
Yes, hi everybody, good afternoon to all. I have a question concerning Al-Hawada Hospital that you just mentioned. We would like to have more information about what is happening there. What can you tell us about the life inside the hospital? In what conditions are the patients in? Do you know if they have food, if they have fuel? And have you been in contact with Israeli authorities to try to get the patients out? Thank you.
Thank you, Agnès. Dr. Pieper-Kohn will take your question. Dr. Pieper-Kohn?
Yeah, thank you very much for the question. Let me say something about Al-Ada Hospital in northern Gaza, and there's also an Al-Ada in southern Gaza, and also Kamal 1. So as the DG already referred to, Al-Ada Hospital has been under siege again, I want to say again, since 19 May, with no one allowed to enter or leave. And we get reports from the hospital and inside and through hospital staff that approximately 148 hospital staff and 22 patients and their companion are kind of trapped inside. The medical staff report heavy fire this morning with live ammunition and damaging critical infrastructure from the hospital, including AC machines, oxygen pipes, solar panels, etc. There are also reported attacks with snipers, so nobody gets close to any on the window, and an artillery rocket hitting the 5th floor where the administration department is located. No injuries were then reported, except that one of the hospital walls was demolished. And I want to say this is the second time. It was also besieged in the beginning of the conflict, as you might remember, which actually included result in 14 deaths of 14 employees and injury to dozens more. 7 employees and volunteers were killed and more than 12 injured, etc. Now, we also have a similar, I mean, the Kamal 1 hospital is very closely located to Al-Ada Hospital. And the latest reports on that are even more concerning. So during last week, during the increased hostilities around the hospital, they got more an increased influx of injured patients, etc. But currently, they were also hit and their ICU, reception, administration, etc. And at the moment, 20 health staff and 13 patients remain. And there are efforts currently, what's going on, they're currently being evacuated. So, I mean, this is the latest reports we can. There's an evacuation currently going on. And as the DG just referred to, these were functional hospitals. We cannot afford to lose that. I just want to make this point very clearly. In my last mission in Gaza, that was in April, from 8 April to 24th of April, I visited these hospitals a few times, Kamal at 1 and Al-Ada Hospital, to bring in fuel, food for patients and staff, medical supplies, but also to bring emergency medical teams and to get patients, the most critical patients, out. The hospitals were functional and things were looking a little better. Fragile, but a little better. Please, we should not forget Kamal Adwan was also the pediatric hospital where malnourished kids were treated. And in April, we saw a number of these malnourished kids, and the pediatrician explained to me that he had seen hundreds of those kids, but they finally saw some improvement in that area. So everything is, of course, very fragile. Now, within a couple of weeks, and this constantly happens, and we have seen this all over Gaza again and again, in the north, in the central, and the south. Hostilities come close. Patients cannot go to the, patients cannot access the hospital, staff cannot come or not leave, etc. Very quickly, the hospitals from partly functional become non-functional. They get damaged, and if wards get destroyed. And if you see this even over a couple of weeks, it needs to it's so unnecessary, and it needs to stop. I also want to refer to what DG was mentioning about Rafah and what a Rafah closure means for the Gazans, and also specifically for WHO. So first, it's the fuel needs, which was related to that. There's 200,000 liters per day needed, 1.4 million per week. Currently, much less is coming in. So impossible choices have to make. Do bakeries get fuel? Do hospitals get fuel? WHO team was actually planning to go to Al-Ahli Hospital, one of the few remaining hospitals in the north, to visit that. They will have to postpone those that business. Medical evacuation has stopped as well. Over to you.
Thank you. Thank you so much, Dr. Pieper-Kohn. Now I would like to invite next journalist, Yan Zheng from Xinhua. Yan, you have the floor.
Thank you, moderator, for giving me the floor. My question is, could you please brief us on the current progress of the pandemic agreement? Thank you.
I would like to ask Dr. Mike Ryan to take this question. Thank you.
Yeah, I just check it. Jawad isn't online, so I will go ahead. I'm a poor Jawad. Yes, thanks for the question. Well, as we speak, the states parties, our member states, are in our large auditorium speaking about the pandemic access and benefits sharing system, which is one of the proposals within the pandemic agreement. Last week, the working group on IHR concluded much of their work. In fact, the vast majority of articles have been agreed in principle. There are a few remaining areas that need to be discussed, and they will be discussed later this week. And I believe the working group in IHR should be able to present a document to the Assembly for its consideration. So we will be fairly confident that process has moved forward, and a great thanks to the chairs of that process and the Bureau and Vice Chairs who've managed to guide that discussion very carefully over the last 2.5 years to what we hope will be a successful conclusion. That process will result in a strengthened international health regulations, and it's important. We've used the IHR for 20 years. It served us well, as Dr. Tedros said in a recent statement. But no process, no protocol stands the test of time without needing to be adapted, adjusted, updated, based on the experience we've had with multiple public health emergencies, and particularly during the period of COVID. With that regard, the work, the IHR process will improve the specificity of the IHR, will improve the interaction that the WHO Secretariat have with member states, and it will clarify a lot of the procedures, and will also, we hope, define the concept of pandemic emergency, therefore making it easier and more straightforward for the Director General to warn the world at times of potential pandemic. With regard to the IMB, which is the international negotiating body on the pandemic agreement, there has been progress. Certainly, we were very pleased to see a lot of greening of text yesterday in key areas like around the global health emergency workforce and key areas like that. So we're seeing a very high level of willingness to move forward. But there are clearly some key areas in which the member states still have some distance between them, and they really they boil down to areas around access and benefit sharing, on the volume of set-asides of vaccine, some issues related to prevention and One Health, and other issues related to financing. So, as Tedros has said many, many times, in these situations when there's much at stake, it very often is at the last minute that we get that agreement. But what I would say is that the atmosphere in the room, the determination of all of the participants is very high. Dr. Tedros took the opportunity to convene ambassadors here a few days ago in Geneva. And I have to say, in my quarter of a century here, I have never seen such an attendance at a meeting in Geneva of senior permanent representatives here. And if that attendance and discussion with Dr. Tedros is anything to go by, there is a huge commitment on behalf of our member states to take this forward now. But the devil is in the detail, and that detail is currently being discussed between the member states. This is an agreement between member states. This is a collective security arrangement. This will allow us to better prevent, better prepare, and better respond to any future pandemics. But it is only possible through international cooperation. And for those out there who speak about this being in some way a breach of national sovereignty, in fact, this kind of work that we do together is in fact, I think as Gordon Brown said in a recent op-ed, an absolute expression and definition of your sovereignty. To be truly sovereign means to engage with others confidently, confident in your own independence. When you are truly independent and truly confident in your own nationhood, that is when you reach out and work with others on issues of common concern. And that's exactly what's happening downstairs. Confident nations working together to find solutions for the betterment of their peoples. And I believe that's what's happening down there. And a great debt of gratitude goes to the negotiators who are doing that right now. I don't know if Tedros wants to add.
Thank you, Dr. Ryan. I would like now to invite Juliette Pereira from Nikkei to ask the next question. Juliette?
Thanks for giving me the floor. It's just to follow up on the INB negotiations. So from what I hear, it seems probable that they will reach a final agreement that will be present on Friday, that will be presented during the WHA. Is that what I hear, or because I've been that it's more complicated and that they might not reach a final agreement, and that they will maybe more present sort of a roadmap in front of WHA, sorry for this. And my second question is that it seems that there is a divide within the African groups regarding this pandemic treaty. Can you give us more information about that as well? Thanks.
Well, it's not for us to decide what the member states will or won't do. What we do know is that the World Health Assembly created and tasked the international negotiating body. And in that, the INB was asked very specifically to consider a working draft of a potential treaty, to work on that treaty, and to revert to this World Health Assembly 77 with the results or the outcomes of that, process, which has been interpreted by them to mean the latest product or draft of their discussions, which would be to what extent they have advanced. If they have advanced the full text to all green, as they say, all the languages agreed, then the World Health Assembly will have a relatively easy task in reviewing that and deciding what to do next. The IMB may decide to present a text that's not completely agreed, with a few issues to be resolved, which could be resolved during the Assembly itself when ministers are here. And there are other options at the disposal of the World Health Assembly to suspend the Assembly, to have a special Assembly. But I think there's a general feeling amongst member states that time is very important here, and unnecessary delays to reaching agreement would not be helpful. But again, it's for our member states to decide. They are the ones, they're shareholders of this organization. We are merely at Secretariat. It's my belief, that's a personal belief, that the member states will make this. I sense that they are getting closer and closer. They're inching, I would say, right now towards agreement. And there's one of these situations where nothing is agreed until everything is agreed. So sometimes you seem far away because everybody is inside that tactical process of trying to find an agreement. We've all done this in our lives. But I believe there's a lot of goodwill there, and I don't believe that there are critical issues that divide the member states at this point. There's at one level some attempt for everyone to have the same understanding of the language. So it's more about having a common understanding of the language that's there, rather than a massive difference. Everyone is committed to vaccine sharing and sharing of products. Everyone's committed to the sharing of data and the sharing of samples. Everyone's committed to a One Health approach to prevention of the next pandemic. Everyone is committed to building a stronger global health emergency workforce. Everyone is committed to strengthening supply chains that broke down during the pandemic. Everyone's committed to investment in research and in having mutually agreed technology transfer to broaden the base of pandemic product production in the future. There is agreement on the outcome of what we want, but this is a negotiation between member states, and these negotiations have legal implications. Our legal counsel is here, Derek, I'm sure, knows better than anyone that language is important when it comes to arrangements that could bind a country later. So countries are being exceptionally careful around the language that's been chosen, and they have jobs to do as negotiators. But it is my belief that they will reach that agreement. And it's really important that they do, because let's leave this all aside, the legal language. This is a life-saving instrument. This piece of paper will be converted into the systems that will protect lives into the future. And I mean millions of lives, because it will set out the rules of engagement, the cooperation, and the way in which countries will engage, and everything from research to training health staff to stockpiling medical products and their distribution. We can only do better than we did in the last pandemic. And we learned a lot from that process. But what we did learn is that without a rule book, without terms of engagement, many people had to create mechanisms from nothing. Bruce Aylward is sitting with us here today. Bruce has direct experience of managing the ACT-A partnership and the COVAX initiative, which produced billions of vaccines that saved millions of lives. And but that process had to be built from scratch from day one. We do not want to be standing that far behind the starting line the next time round. So we've learned a lot of lessons. We've been led by some incredible people towards our response to COVID that saved a lot of lives. But I think the member states now have it at their responsibility to be able to give us a set of rules and a set of processes that we all agree into the future will help us prepare better.
Okay, thank you. I would like now to invite Belissa Godino from W Magazine to ask the next question. Belissa?
Hi, thank you for taking my question. I would like to know if there is any update or detailed information within the World Health Assembly regarding the climate change and global health. What measures are already implemented and other new ones that are planned globally? Thank you.
Yeah, thank you. One of the strategic roundtable discussions will be on climate and health. And as you may remember, we had the same last year. And between last year and this one, there is a major development. We thank UAE for a dedicated day for climate and health, and also for the declaration that was agreed during the COP28 in UAE. And this roundtable will help us to discuss on the outcome of that meeting and also all the activities in between. But at the same time, to help us also prepare for the future, aiming at the upcoming COP29 in Azerbaijan. As you know, health is the most compelling argument because due to climate change, the health of people is being affected, be it non-communicable diseases or communicable diseases. And from the increase in communicable and non-communicable disease, we can understand that climate change is happening now. It's not about a future issue. And using that argument is very, very important. For instance, because of heat waves, cardiovascular diseases are increasing. And with regard to communicable diseases, dengue and malaria are being now transmitted in areas which have not been known in the past. And a long list of health problems actually associated to climate change. So we hope this roundtable strategic dialogue will help to assess the current situation and prepare for the future. And this is one of the central and priority agenda in our strategic plan that's now prepared and that will guide us for the next 4 to 5 years. Maybe Bruce is with us, and if you can also highlight the climate and health as part of our strategic plan would be important.
Sure. Thank you very much, Dr. Tedros, and good afternoon to our reporter colleagues. As Dr. Tedros highlighted, next week among the major issues that will be considered by our member states, our 194 member states, will be a new strategic plan for global health for the next 4-year period. And this is anchored in our mission to promote, provide, and protect health. But it is then outlined 6 major strategic objectives that'll then anchor our work for the next 4 years to try and get not only the SDGs back on track, but also to advance health equity and to build resilience in health systems. And first among those, the strategic objectives is to address the challenges of climate change and health. And this is quite significant because in developing the strategic plan, as Dr. Tedros said in his opening comments, this involved an extraordinary, and I think the word used, Dr. Tedros, was unprecedented consultation globally. So not only with our 194 member states, but also with civil society, with youth groups, with private sector associations, with our UN partners, Gavi, Global Fund, other international agencies we work with. And across all of those negotiations, climate was raised as not only an important determinant of health, but one which cross-cut and uniquely affected everyone, everywhere. So this is very much part of what will shape our agenda for the next 4 years and the deliberations of the Assembly as well. It was not without its, let's say, frank discussions with people coming down on both sides of how important part of this agenda should be over the next 4 years. But it resulted in a very, very strong consensus that indeed, for again the reasons Dr. Tedros laid out, this should be really one of the anchor issues for global health for the next 4 years, and it will be thus reflected in next week's assembly.
Dr. Katarina Boime, if you want to add any details.
Well, just to add perhaps a last piece that clearly demonstrates how important climate change and health is for our member states next week. And that is expressed through a resolution that all 194 member states are working on at present. Negotiations are still ongoing for this resolution on climate change, pollution and health, which is being led and championed by the Netherlands and Peru, but being joined in by many other member states. Thank you.
Thanks so much. I would like now to invite a journalist from a publication called Pink Sheet to ask the next question. Elisa? Elisa? No.
From Rugby. And I was just wondering how the new WHO listed authorities will help to improve global health regulation and how it's different from the former stringent regulatory authorities.
Mm-hmm. I would like to ask Dr. Yukito Nakatani, who is Assistant Director General for Access to Medicine, to take this question.
Thank you. Thank you very much. The question on the WHO listed authorities, we call the WLA. Before answering the questions, let me explain briefly the background of the WLA. So this WLA is the framework for the designating and the publicly listing as the regulatory authority for the operating and advanced level of the performance to be globally recognized. Then we facilitate of the evaluation process upon a request from the member states. Then WLA is the transition from the stringent regulatory authorities, SRA, and our procedure. And the transition period is until the end of the March 2027. So we are still in process on the transition from the SRA to WLA. And then this WLA framework is intended to promote access to the safe, effective, and quality assured medical products. This also provides for the optimal use of the limited resources in agencies by facilitating reliance mechanisms among the trusted agencies, including WLA, to take harmonized approaches to share information and the decisions. This is also able to avoid the duplications of the work across trusted regulatory agencies and to simplify the process of the WHO pre-qualification program. So we listed the first 3 countries in last October with piloting the evaluation process. After that, we rolled out this program broadly upon the request of the member states. And yesterday, we listed more than 30 new authorities, which is a great achievement for ensuring access to safe and quality assured medical products. We are expecting more authorities will apply to the WLA in coming years within the transition period. So the current listed the authorities is the US FDA and the European network. And then we are expecting the other of the stringent regulatory authorities will apply to the WLA in the coming years, before the things. And also this WLA is expand from the SRA, the network. So we expecting the expansion of the harmonization in globally more than the SRA's the procedures. So that part is the contribute to the using the more the efficient procedures to ensure the access to the quality assured health product. Thank you very much.
Thank you. Maïva Chabrier from Kyodo News sent a question in writing, and her question says, should we expect the AHR and the pandemic treaty to be discussed, approved the same day? If yes, when? I think we, or you can also follow the agenda of the World Health Assembly. Every day we will have the journal that will be posted, and you can follow the agenda of the World Health Assembly. If not, Katarina, you want to?
Well, perhaps just briefly. So the INB discussion has been locked in for the Tuesday 2:30. So that will be the start of the discussion. And then an important milestone will also be reached on Saturday, 1st of June, when we basically, when the plenary concludes the IHR discussions. So I think those are probably the key anchor points. Everything around that is still to be seen.
Thank you, Dr. Boime. Let's now invite ABC journalist to ask the next question. Can you hear me? So I think you cannot hear me. We'll see if we have other journalists online. We have Ellen Fletcher. Ellen? Ellen Fletcher, Health Policy Watch.
Thank you for taking my question. Can you hear me now?
Very well. Go ahead, please.
Yes, regarding the health and climate resolution that's being negotiated, you gave an assessment of how likely we are to get to the finish line on the pandemic treaty. I'm just wondering if you can give us any sort of assessment on how likely we might get to the finish line on the climate and health resolution, and if perhaps that might risk getting pushed aside because of the understandable urgency of the pandemic treaty, but at the same time, climate's also urgent. So just if you could comment a bit more on that resolution, I'd be grateful.
Thank you, Ellen. Bruce, Dr. Bruce Aylward.
Yeah, thank you very much, Fidela, and thank you for the question, Helen. There's an ongoing negotiation on the resolution. So this resolution is sponsored by two of our member states that are co-chairing it, the Netherlands and Peru. And they had their most recent meeting just last week. There was broad consensus on all major elements of the climate change resolution, I'm very pleased to say. And there's a couple of outstanding issues. They're similar to issues that are reflected in some of the other open resolutions. But I think we're in, I should say, our member states are in a strong position to be able to successfully conclude that one by the time we get to the Assembly itself. It's our understanding that that resolution will go into what we call a silence procedure in the very near future. And if unbroken, then there will be considered by the Assembly next week. But most of the major substantive issues around climate, actions on climate, actions by both our member states, I should say climate and health, actions by both our member states and directions to us as the Secretariat are agreed. So in pretty good shape, actually.
So I think we can close this press conference. I'm just checking once again if we have more journalists asking for the floor. I think no. So with this, I would like to thank journalists for joining us today and hand over for Dr. Tedros' closing remarks. Dr. Tedros, you have the floor.
Thank you, Fadila. So thank you to members of the press for joining us today, and see you next time. Thank you.